Good morning, everyone. Welcome to CEDA's live stream on health and technology. This is the first event for the year in our Human Services series. Today, we'll be exploring the ongoing transformation in Australia's healthcare system. My name's Cassandra Windsor, and I'm Senior Economist at CEDA, the Committee for Economic Development of Australia. CEDA acknowledges that today and every day we're on Aboriginal land. Committed to recognition and reconciliation, we respect elders and we support their stated aspirations. Today I'm coming to you from Perth on the land of the Wadjuk people of the Noongar Nation, and I'd like to pay my respects to the elders past, present and emerging. The work that CEDA does is only possible through the support of our members. To that end, I'd like to acknowledge the sponsors of today's live stream, Microsoft, and thank them for their ongoing support. We have three fantastic speakers today. Professor Mary Foley, AM, is Managing Director at Telstra Health. Dr. Nick Woods is Health Industry Executive and Chief Medical Officer at Microsoft Australia. And Evan Rawstron is Partner in Charge of Policy, Programs and Evaluation, as well as Global Lead in Health Analytics at KPMG. I encourage our viewers to follow CEDA on Twitter at CEDA_news and to join in today's conversation using the hashtag health technology. Today, our viewers can interact with our speakers and participate in the discussion using the Pigeonhole app. You can enter directly via the live stream page or go to ceda.pigeonhole.at and use the passcode Digital Health. You can enter your own questions or view and vote on the questions of others. We've seen rapid technological developments in healthcare in recent years. Today, we'll be exploring the ongoing transformation underway in Australia's healthcare system, the role of new technology and artificial intelligence, and underpinning all this, the use of data for improving patient care and health outcomes. I'll now hand over to our panel of experts, starting with Evan Rawstron from KPMG, to make his opening comments.
Thanks very much, Cassandra, and thanks to CEDA for having me here today. In thinking about our conversation over the next hour or so, I thought there were two or three things I'd share from our work and research across 46 countries in our global healthcare network. As healthcare systems are beginning to contemplate what comes after COVID and their emergence into a new reality perhaps, there are some clear trends we're seeing. The first of those is that the significant investments that have been made in new digital access points for consumers into services are going to be sustained, and I suspect investments will accelerate in the years ahead. There's a recognition of the important role that data's played in decision-making, particularly over the last 12 months, and a desire to invest further to accelerate transformation in care systems around the world. There's genuine recognition, I think, that change in things that matter most, for example, better experiences for consumers or better integrated and safer care, for example, may actually require substantial changes in the way our care systems are organised. And when we look around the world, we're starting to see major structural change emerge in a number of jurisdictions. There's been widespread acceleration in investments in measuring the experiences of consumers and work ongoing to improve that experience in many health systems. And finally, whole of organisation or whole of system performance improvement is going to be critically important in the years ahead, particularly performance of back and middle office services in environments where there are fiscal pressures and financial pressures. And so in looking at those themes, digital transformation and the role of technology would seem to be a bit of a steel thread. It's an area we've been commissioning research on now for about 5 years in partnership with Forrester, and we've now got a data set that covers 17 industries. At a macro level, there's strong cross-industry support for the importance of 8 distinct capabilities for navigating digital transformation in all of those industries. In healthcare, the commissioned research covered health systems in 9 countries and included respondents, about 400 health executives in those systems. Of the 400 execs we spoke to, 80% said that putting consumers at the centre of their strategy was their highest or a top priority for their institution, a priority they would be making significant investments in over the coming 3 years. Interestingly, when we asked those same executives about the top 5 obstacles to achieving their strategic objectives, they told us that 3 of the top 5 barriers related to data and a 4th related to architectural problems associated with driving value from legacy technology systems. Less than half of the executives we spoke to felt that they had the ability to effectively harness data and analytical platforms to get timely access to insight. Less than half, which to my mind signals a significant gap in the capability that those executives had access to. And we know from our experience in the research that building and sustaining the right capabilities is a pretty critical part of delivering on strategy. So for me, there are a couple of key takeouts of this research that I thought were important for today's conversation. The first is around the ability to realise return on technology investments. And our ability to realise that return is often heavily dependent on investments in organisational capabilities and the existence of those capabilities. Those capabilities in areas like data and analytics, person-centred design, supply chain and operations, and digital architecture, to name a few of those 8, haven't really been historical strengths of healthcare organisations and healthcare systems over the past 20 years. And there's considerable amount of commentary about the fact that healthcare's lagged in investments in those critical areas. So as we look to the future and we think about technology and digital transformation in the years ahead, there is a bit of a paradox perhaps in front of us. That paradox being that the more we invest in and rely on technology and the more we expect from it, the more important it's going to be to build and sustain the right capabilities in humans in our workforce. I'm really looking forward to the conversation today. Delighted to be here with Mary and Nick. Thanks for inviting me, Cassandra, and I'll hand back to you.
Fantastic. Thanks, Evan. Great opening comments. I'll now pass on to you, Mary, for your first comments.
Thanks, Cassandra, and thank you also. I'm very pleased to be here with my 2 fellow panellists, Evan and Nick, on such an interesting topic. We certainly have seen unprecedented adoption of digital technologies in both the health and aged care sectors here in Australia over the last 12 months. And it's been impressive to see just how responsive we as a community have been to address the urgent needs that were in front of us through the course of last year and continue to be so. From where I sit and what we observed, we saw 4 key factors that supported this rapid advancement and responsiveness and made it possible. And it's important to understand, what those factors were if we're looking at how do we further leverage this into a new business as usual for both health and aged care. Critically, people, including ourselves, were able to leverage developments in digital health that were already in place due to government and industry investment over many years. For example, standardised ways of safely sending clinical information. And the significant level of digital technology adoption by GPs, hospitals, pharmacies, and aged care, to give examples. So there was plenty there to work with that could make things happen quickly. Then the second ingredient, critically, was that the government accelerated the policy solutions that were needed to realise that next evolution of those technologies that were already there. So some of these policy solutions have been on the drawing board for some time, but what happened was things that were being explored as new models of care with one-off policy and funding experiments here and there, suddenly overnight through necessity went to scale financing and delivery. And that literally happened overnight. And of course, the big changes here in Australia were the changes to the medical benefit schedule and the pharmaceutical benefit schedule to, for the first time, support virtual consultations under Medicare and fully electronic end-to-end prescriptions, including expanding the availability of psychological services delivered this way on the MBS. This was a huge reform. In fact, I think the Minister at the time and several times since has said that this has been one of the biggest changes since Medicare was put in place, and I think he's right. So there was this huge regulatory and funding piece. Then thirdly, healthcare providers have innovated incredibly in how they deliver care to meet the challenges of COVID, including telehealth in primary care, less talked about telehealth in hospital outpatients, home monitoring and hospital in the home services, different ways of using technologies to have virtual care in the mix of the care of patients. And most importantly, consumers, the fourth ingredient, the fourth factor, have been willing to adopt these new models of care delivery, in the first instance, of course, as a workaround under COVID, but finding that in many circumstances, and I think all of us have had this experience to some extent, virtual care modes of delivery can be preferable. So as we move into this next stage of, and I won't say out of COVID, but this next stage of managing COVID in 2021, we can see that these developments are starting to shape the way we think about the future of health and aged care in the immediate term. And it's increasingly clear that there's no going back on any of this stuff for business as usual. But the key challenge is, how do we capture the benefits of digital adoption and sustain the ongoing development of these models as we move from a crisis management, where the trade-offs of risk and benefit meant that the risk of pandemic meant that shortcuts were found, particularly perhaps in some of the regulatory areas, to the new business as usual going forward. So, for example, the federal government has maintained the MBS changes, but is working on and says that it intends to have them going forward, but it's busily looking at and reviewing the rules and standards that will support the permanent adoption of virtual delivery of care. And there's a great deal for us all to work through as to what does that look like, what are the standards, what are the arrangements, what's the risk selection. And that review at the moment is currently due to land on the 31st of March. And also now, as I heard one state health CIO say, telehealth is so 2020, and as we come into 2021, it's all about vaccination, and we've heard nothing else as the leading story in the news for all week. But the country, many of us are all involved in working out how best to capture COVID vaccination data for monitoring and planning purposes, leveraging existing systems such as we have the Australian Immunisation Register, the MyHR, we have a number of approved personal phone apps which give people ready access to their MyHR data, and we have various state and hospital systems that will be involved as well. So a lot going on there which will create new shifts and developments over the next few months. But I wanted to mention this morning also, and put on the agenda, that one of the largest areas of change that we see happening in the next few years will be in aged care, where we're going to see a significant leap forward in the application of digital technology in both residential and community care, and most importantly in applications which better connect health and aged care services. It's anticipated that the Royal Commission, which is due to report tomorrow, will call out a significant role for digital systems as part of the response to the challenges in that sector. And of course, COVID only further emphasised those challenges. It's important to realise there's already a good baseline level of digital technology in aged care, with over 80% of all residential care beds having digital clinical systems, and about half of those beds already having medication management systems as part of those systems. So there's a base to build on. And then the sorts of areas that we're expecting to see embraced, on what we've seen from the Royal Commission so far, is that digital solutions have many applications to support aged care providers to deliver quality care. Firstly, improving quality and safety at the bedside. For example, medication management systems can prompt staff to check a dosage and check that with the prescribing doctor or the registered nurse before administration of a medication, just to give a very simple and obvious example. The collection of data, what Evan was talking about, that came from the surveys there. The collection of data for clinical governance purposes and implementation of quality standards. So in the first instance, clinicians and administrators of residential care organisations can have visibility of quality indicators and the benchmarks and risks in the organisation. And then also from a national level, these systems will support transparency of performance and benchmarking at a national level, supporting policy and system improvement in an informed regulatory environment. And then most importantly, safety and continuity of care between settings, and this will have huge benefits into aged care and into healthcare, because there's a significant opportunity to improve sharing of information between care settings, the residential facility, urgent emergency departments, pharmacy, the person's GP, and specialist clinicians and community delivery of aged care services. The My Health record will have a role to play here. We've heard from our aged care customers that there are a few immediate areas of potential high value there that could be captured. One is at the admission to residential aged care, where frequently a resident moves, a person going into residential aged care moves away from where they live to get that place. And so being able to access information from the patient's GP about their clinical background and requirements would be huge. And then also the transfer between the residential care facility and an emergency department of hospital, where particularly medication records are particularly valuable and where the most risk of harm occurs when it's lacking on a transfer. Also, from our experience, connecting people and their carers to their health records via mobile, via MyHR mobile apps, also has a key role to play. And certainly we were able to support some aged care providers with some of that kind of mobility support to communicate with families. So I hope that the next time CEDA has another session, because we had one some months back about what's happening in digital in healthcare, and I do include aged care in that. I think we'll see a whole lot of other things happening as these various things that are happening now in the focus in 2021 are happening. And it's about technology, but it's also about policy, it's about workforce, it's about training, it's about regulation, and it's about payment models.
Fantastic. Thank you, Mary. And I will just point out to the audience that we do have the Q&A section of the session coming up soon, and we'd love to ask some audience questions. So please log on to the Pigeonhole app and pop your questions in there. And now I'll pass over to Nick Woods for his opening comments.
Thank you very much, Cassandra. Thank you, everyone, for making time. It's always a privilege to participate in a CEDA event. They've been a great partner for us, and also to be here with Mary and Evan, just to have this conversation. And if I think about the breadth of the conversation we could have, it's massive. And, I think we could probably spend about 3 or 4 days talking about many of the topics we've touched on. I've actually playing a different role today. I've been asked to talk a little bit more around artificial intelligence and its role in healthcare. And I think out of all the topics we've touched on, perhaps it's got more than its fair share of hearts and minds and media coverage than some of these other key areas as well. And I always start that artificial intelligence, machine learning is just a tool, and sometimes it can become a bit of a narrative in its own right, but it does have some special and unique properties in that it's very potent, and its application and its potential is massive. And fortunately, I think as a healthcare industry and thinking about how we can leverage these tools, we have matured. Probably a few years ago, we were hearing a lot of narrative around, the AI will see you now instead of the doctor will see you now. The replacement of radiologists was a conversation that hasn't really materialised, and I don't think it will. And also every digital investor would have startups come and pitch their ideas, and there'd be AI washing all through it. And if you think about autonomous cars, it's probably ridden a similar path. Probably 4 or 5 years ago, we all thought we'd be driving around in autonomous cars by early 2020s, and we're not. But there has been some incredible progress, and I think many of us will look to the future as being very confident about the capabilities that we have to bear. Coming back to the challenges that artificial intelligence and machine learning can help address, we're very fortunate. We have an incredible health system in Australia. Obviously we have been very focused on the pandemic and some things that has brought, and it has brought forward some, I think, great aspects of digital health. But we have had these ongoing challenges. We know we've got a major nursing workforce shortage. We know we've got additional complexity of disease, inheriting that being a first world nation. And then also the mental health burden. I think many of us will have seen, the Productivity Commission and the value of the burden that that's creating, and perhaps not addressed as well as physical health. But I just wanted to pause for a moment and say it's not just clinical care that the role of AI in health more broadly can play a role in. So things like research, we're seeing a huge amount of activity in drug discovery and new diagnostics. We've just announced a piece of work we've been doing with a biotechnology company out of Seattle called Adaptive Biotechnologies, and we've announced a new T-cell test for COVID, which is a completely revolutionary and different test, but also some of those operational scenarios as well. If we think about cost pressures on our health system, how do we do things in a slightly different way that can bring in efficiency? So predictive maintenance of equipment, or even more automated coding of health information to streamline the process of coding for reporting back up to the governments. So I thought I'd quickly talk a little bit about where is AI at in health, and this will frame some of the conversation we'll have later, but just a couple of touch points that I think are worthy of note is that by the end of this financial year in mid-21, that investment in digital health in the US is predicted to have increased by about 30% from the previous year, so pretty incredible amount of additional investment. AI-related entities and startups and more mature entities are getting a lot of that investment. So I think there's a confidence there that the industry is maturing, but also we're seeing that in real terms. If you look at the US FDA, the equivalent of our TGA, which has been a little bit further ahead in terms of evaluating software as a medical device products, where a lot of these AI type products will fit and have to go through this evaluation. And about 18 months ago, there were about 20 solutions. Now it's over 70. So these are companies that are doing things like BizAI to have a look at the triage of a stroke CT scan, or a live core that some people might know about, having a look at your ECG by putting your thumbs on one of their little devices and seeing if you might have some abnormal rhythm of your heart. But I think one of the things that I'm incredibly buoyed about also is it's a lot more grassroots. And I think particularly from my lens as a technology provider, we're not trying to provide all these endpoint machine learning models. We're trying to provide the sets of tools and the skills and knowledge so people can take advantage of these capabilities to use these tools for the things that make sense for them. So, we're seeing things, for example, using natural language processing, so having a look at radiology reports to compare initial and secondary read of radiology reports to see if perhaps a registrar might be there might be an opportunity to learn or pick something up that they might not have seen in that initial read that the senior consultant does. There's also been some great work that's come out of Austin Hospital here in Melbourne, where I'm based, and particularly at the start of COVID, where they built out a remote platform for patients that were COVID positive. They even included a way of capturing breath sounds, so the person breathing into or counting from 1 to 30 in their mobile phone, and using that to see if they could look at it as a proxy for early deterioration. So they haven't gone to the commercial market, they've just used tools that are available to them. Some of the obstacles, though, I think, we've touched on it. We have a lot of variable data. It's very siloed. We know that there are always going to be challenges when we think about how machine learning models might be built to look at one particular population. How generalizable are they going to be to another one? And I think one of the critical and key things here is that we always must think about however these technologies work, how do they support the clinical workflow? And the clinical workflow comes from how clinicians work that makes sense for them, but that also aligns with how we're delivering care, funding, and some of those other things. So I'm very proud of some of the work that Microsoft has been doing in this space. We're actually recognised as a leader in AI in healthcare. We've also invested significantly. We've got a $60 million grant of AI in health, which has been diverted a lot in the last 12 months around COVID-related projects, as well as mental health. And one of the things that I think we did, and if it's an area of interest, is also establishing an ethical framework and governance framework to evaluate AI machine learning projects and make sure that we've thought through some of those topics I've touched on, like governance and generalizability. So Cassandra, thank you.
Thanks, Nick, and thanks to all our panellists for their opening comments. We've started to get some questions coming through, so that's fantastic, but please do keep popping them in the Pigeonhole app. Look, I think something kind of underpinning all the conversation and really all the developments in the technology and in healthcare is that issue of data. And I'm also interested in the role of the consumer and the community here. So there are clearly sectors of the community that don't necessarily trust the online records or how their data is being used, both in that kind of patient care outcome and in the research and longer term outcome. So what can we do to really communicate better to the community what the benefits are, and also that their data and their personal information is being kept safely? I might start with you, Evan, but happy for anyone else to jump in as well.
Thanks, Cassandra. I mean, I think it's a absolutely critical point, this issue around trust and community trust, not just in data and data governance, but I think also in the way that data will be used in the future by artificial intelligence and machine learning. There's a great piece of work done by Nicole Gillespie and her team at UQ in partnership with a colleague of mine, James Mabbott, where they looked at community expectations around AI and the level of trust that was associated with AI. And I think if I think about the key takeouts of that work, there is an uneasy relationship between Australians and artificial intelligence. Most accept or tolerate it, very few approve of it or embrace it. Almost 40% of the respondents to the survey that Nicole and James ran were unwilling to trust information provided by or to share information with an AI system. And trust was really dependent, when we drilled into that, trust was really dependent on perceived adequacy of the current regulations and laws around data security and AI, uncertainty of the impacts of AI on society more broadly, and also importantly on jobs, and finally some fundamental gaps in the community in the understanding of AI. So I guess when we step back from that and ask, what can we do about it? There are a couple of things that spring to mind. The first is, first and foremost, minimising the number of things that further undermine that trust. So that means a big focus on cybersecurity and ensuring the security of information. It also means increasing the focus on data governance and data quality, because often one of the things that undermines consumer confidence is not absolute breaches of systems, but rather, failures of data quality and data governance, where they have information available to them that isn't theirs or is incorrect. I think the second thing is to better promote the benefits of access to wider and more secure access to data, interoperability of data, both at an individual level as well as a community level. And I think Mary talked earlier about electronic prescribing. It's a great example of something that's going to make a really meaningful difference to consumers. I think one challenge, just as a side note, is that sometimes the value of data and the value of AI is in preventing things from happening. And so when those things don't happen, it's difficult to explain the value proposition of that to individual consumers. They tend to be looking for more concrete symbols, I think, of trust. The final point I'd make in terms of action is probably the importance of improving transparency of the way that data and emerging technologies are used in healthcare settings, and ensuring that consumers and consumer peaks are actively engaged in governance and decision making. And I think Nick talked earlier about the importance of frameworks to navigate the application of some of these technologies and to really think carefully about their ethical application in clinical contexts.
Yeah, fantastic. Nick, have you got something to add there? Because you did talk about, the ethical and governance framework around AI, and that seems like it's a step in this direction to ensuring that consumer trust.
Yeah, absolutely. It is critical that we, get this right. It's a complex discussion. I mean, I think there's different dimensions to it. So one is, around, what happens to your data. And I think, that obviously has to be a very transparent and understood conversation about, what's happening to your data and the security around that. There's certainly, that technology layer about cybersecurity and so on. But I also think there's a bit of a narrative that we collectively, and I'm talking about the regulators and the health community, need to carry back and educate the community as well, that, we do have these, regulatory processes. TGA has just released their software as a medical device, draft release in the last few days. The same way that we evaluate medications, there is a framework there. It's not something we just throw out there. And every day clinicians are having conversations with patients about, likelihood of a diagnosis. Some things aren't black and white, or best treatment pathways and options, and they're not, entirely clear. And it's the craft of clinical care. And I think if you're a clinician sitting there and you know that you've got some of these tools that can assist in that process, I think as long as the discussion is had with the patient and consumer there, then that's a good thing. But I think it will have to be more of a public education campaign as well as that interaction.
Yeah, fantastic. And Mary, you talked about the role of My Health Record and some of the benefits that can bring. Do you think the community does understand the benefits of something like My Health Record and the role that can play in improving healthcare outcomes going forward?
Look, I think they do, in terms of the whole opt-out model that, when it was adopted, created quite a bit of angst in the community and amongst health providers as well. And in the lead up to the important opt-out dates, but in the end, most people chose not to opt out, and I think particularly we all have contacts with the health system, even if we're those of us who get ill. Yes, the full gamut with what the acute care system can offer and the latest of medical technology can offer. But if you look at, I've forgotten now, is it 7, Evan, you're probably more up to date than me, 7 GP consults a year average for each Australian citizen, something like that. As soon as you have children, I didn't have a GP till I had children, then I think, this is why people have GPs. And then you're getting your immunisations, and there's just so many, you're checking sight and hearing for your child as they develop. Then you have you have babies, and then it's there's a whole. We're interacting with the health system all the time, and it's a critical part. It's woven in our lives, since the second half of the 20th century, once technology meant that it had a huge role to play. And so I think people readily accept that they want the system to have their information and know what it's like when you're got either you go to a different clinician or your GP refers you to a specialist or something, and then all they've got is the referral in most cases, and then you've got to sort of, you're the one carrying it around and bringing the information together, whether it's about yourself or your child or your elderly family member. And so I think people can see the value of that, and in fact many thinking, well, why do I have to carry my medications around in my head? Why can't I show them to you? So, and I think the thing about COVID and going to this level that we had to at scale to keep everybody safe created just this huge accelerated experiential learning environment, which has meant we got to feel what it was like, just like this massive moving to working at home, and guess what, productivity didn't really seem to go down, and in some instances people even found it better. I think that's been very important for people getting their heads around it. And then the other thing is, it's a bit like the ACCC has taken on the tech platform giants about just how other regulation that applies in other spheres, just because this is tech, that digital tech, that it somehow doesn't apply. That's an interesting debate that's going on in this country with those providers right now. I think the TGA getting developing its approach on software as a digital device, or indeed software, if it was a drug. You would be measuring it, checking it. There'd be false positives, false negatives. There always is. No drug is absolutely perfect, and no drug affects an individual in exactly the same way. But whether it's safe to use, you have your normal curve, and you're looking at, what's the spread. If it's a new test, how the specificity of the test and the sensitivity of the test and the trade-off of those things as to whether it's going to be efficacious. In healthcare, for any of the technologies we use, we are weighing up the risk-benefit trade-off into a safe, it's statistically done, but into a safe framework. And technology is no different. And I think we're starting to, there's been the rush of invention and trying to work out, we've got all these databases, how do we start to connect them in meaningful ways without having to make everybody just go and use the the one set of, the one system, and a lot of progress has been made on that. IHIs are very important and so on. So I think the stage of development we're in is a maturer stage now, and I actually think the community's got to a maturer stage about their understanding of it. We, involved in healthcare, aged care and in technology, have to, it's our job to keep communicating about it, and also thank you, CEDA, for panels such as this, which help to get these conversations going.
Great, fantastic. And I'll throw to a question from our audience now. And so it's from Dr. Ricky at ACU, and they're asking, what are some countries that have, kind of a bit further advanced than us in, say, telehealth or health data analytics? And are there some things that we can learn from overseas examples? Evan, I might start with you.
Thanks, Cassandra. To pick up on Mary's comments, I actually think there's a lot of credit that needs to be given to the Australian healthcare system for how advanced our country is. I think sometimes there's a sort of tendency for us to look overseas for wisdom, and actually there's an enormous amount that I'm certainly proud of when I go and sit on the phone with international colleagues in terms of what we've been able to achieve as a nation. And I think Mary talked earlier about the criticality of some of those important pieces of national infrastructure in enabling our healthcare systems to respond effectively to a crisis of the scale we've almost never seen in the past 12 months. I think that having been said, there's always something to teach and something to learn. And so Nick is, probably well positioned to talk about some of the trends he's seeing in Silicon Valley. But when I look at healthcare providers around the world, some really remarkable innovation always coming out of Israel, and some terrific examples, I think, of the way in which artificial intelligence and machine learning is being conceptualised to enable nursing staff, particularly in areas like cancer, to work to their full scope of practice and to improve the consumer experience in pre-hospital care, to try and reduce anxiety and improve access to information. So great examples of where new and emerging technologies are actually solving long-standing problems, not to actually reduce the workforce, not to substitute the workforce, but rather to improve experience and improve safety. So that's certainly one example. I think there are other great examples out of Europe where they've managed to achieve national coverage of electronic health records, but I think certainly the Australian track record on that front is absolutely excellent and nothing to be ashamed of. Nick, I don't know if you've got a view about some of those emerging AI startups and cases of interest. Mary, you certainly would as well.
Yeah, I think, certainly we're seeing, as I touched on, the 70-odd companies have gone through the FDA US sort of system, and we're seeing some of that spring up here in Australia now. We've actually got quite a vibrant market of people that are doing a lot of computer vision work in healthcare and actually making an impact in health. I think this sort of touches on some of the areas in the column of AI that excite me, and one in particular is around taking voice transcription, so duplex conversation between a clinician and a patient consumer. So, for example, we've done some work with Nuance, and the way this works is it'll actually transcribe that conversation and then pull out medical concepts as part of that conversation, and even tee up what the clinician might want to do through their electronic medical record. And if you think about that for a moment, that's incredibly powerful. One of the big narratives around and criticisms of EMRs in the US is they take too long to, prescribe and write their notes. That's not really a technology problem. It's more of a funding problem and what they have to do. But that we know that EMRs have some ways to go around some aspects of the UI and UX in many areas. So if we can bring in these technologies that take the technology out and we get the interaction back again between patients and clinicians with the same safety, I think that's incredibly exciting. Evan's point about analytics, I think I'm incredibly proud of some of the things that we've done here in Australia. In my conversations with my global colleagues, we punch above our weight. We're doing work around a state jurisdiction of a real-time analytics platform, and there was a lot of work to set that up, which is getting real-time data out of the EMR. Huge amount of work to set it up, get skills up to speed and so on. But making that investment now has meant that they could move at incredible speed when things like COVID hit, because they had a lot of that data from different systems coming in. And I know we've got the talent here as well to be able to leverage the technology. I think it's just how do we coordinate that? And then also, I'd love to see Australian businesses succeed on a world stage as well, and I think we can.
Yeah, fantastic. And I might follow up with another question that I think leads off a bit of that, which is another question from our audience, which is from James Marshall, about how can we support the growth of health startups in Australia? So what more can we do to encourage that ongoing innovation that it sounds like we've already got quite a lot of, but obviously we want that to keep progressing?
I might start, if that's all right, Cassandra, because it's something that I personally do quite a lot of work in, and also as a company we have a reactor in Sydney as well. So we have a program to support a lot of startups. We've got in digital health, there are a bunch of programs out there. We've got MedTech's got talent in the actuator here in Melbourne, and some really vibrant hubs. So I think there's some great work, and we've got And Health, which is putting in a fantastic program to really start building up people's skills and entrepreneurship and so on. So I think some of the pieces are coming together. It's getting a little bit more streamlined and coordinated, but I think it'll be a bit of a maturity model. I mean, this, sometimes getting things stood up in digital health is challenging, but I think there's probably a little bit more to be done around taking innovation to where it's needed and joining up with, the healthcare services or wherever more directly, rather than, out in a centre outside that. But I think we have moved the needle, and, we should be proud of what we're seeing. We're getting some great companies also succeeding in the US and so on.
Fantastic, great to hear. Mary, you mentioned quite a bit about the benefits of digital health in the aged care setting, and just want to touch on that in a bit more detail. And one of the questions that we have come through from our audience is around digital literacy of the workforce.
Yes.
So you've seen some of these great improvements, but do the staff working in these aged care settings and in healthcare more broadly have the digital literacy that they need at the moment to really get all those benefits out of it? And if they don't, what more can we do in that space?
Look, that's a very important point, particularly from the health policy and regulatory side, and I've spent a large part of my life wearing those hats too. There's a tendency, and you could see it during the worst parts of the COVID last year, a tendency to assume that residential aged care is somehow a sort of just a step down health facility, and it's not. If it was, it'd be called subacute care and funded very differently and operated very differently and funded at a much higher level, I might say. It's being developed on the basis that this is substituting for the person's home, in that they are not able to be supported at home. Combined with that, the primary access to healthcare is that as Australian citizens, the aged resident has access to a GP just like you or I do, funded under Medicare, has access to the PBS similarly, and if they get sick, you can dial 000 and an ambulance can take them into hospital. Of course, I'm sure I don't want to preempt anything the Commission's saying, but certainly the sorts of things that have come up during the Commission hearings and so on, of course, is that while that philosophy was very important, especially, this aged care approach has been developing for 40 years of policy iterations, but where we've got to now in terms of those people that are assessed as appropriate for residential aged care, but even those people trying to be cared for at home with an ageing population, that's probably a too simplistic approach to thinking about what the aged care challenge is. So coming right back to the business model in aged care and the way it's funded is around having personal care workers as the primary workforce, not trained health professionals, and so this is where digital clinical systems if a digital clinical system for aged care is going to look very different from the ones you have in a hospital, for instance, or in a GP office, where you've got highly tertiary trained, professionals accessing the information with a great level of sophistication. The ones in aged care have to be designed that the person the personal care at the bedside or in the, the activity room, or the, helping a resident, manage to go to the dining room, or whatever it is, that they can access it, know what the instructions are about, does that person need to be assisted, has the family and the individual under, sort of personally, patient or consumer-directed care. It's been agreed that while it's a bit risky, they don't want to use their walking frame to go from, the bedroom to the bathroom, so don't make them, but therefore, supervise carefully and so on. But the ways you present that kind of information onto the screen is very different and very sort of, it can be quite visual in terms of realising that you're not looking at tertiary educated folk that you're trying to support with this. Certainly part of what we have in our aged care part of the business is a policy where we have our people take a volunteer day and get to spend time actually being with a personal carer and our customers and actually see how their software they're developing gets used. And and I think there needs to be much more of this thinking about what the model of care is in aged care, and then having very specific models of how they support that care and how they create a safety and support given the model. And then on top of that, much better and more effective connection into the health services, because it's not reasonable to assume an aged care resident can just go to the GP or the specialist of the hospital in the way that those of us who are fit and well can.
Sandra, a couple of other observations perhaps. There's a piece of research from a few years back by the OECD that shows that almost 80%, I think it's about 79% of nurses reported regularly performing tasks for which they felt overqualified. And so I think one of the challenges here when we think about technology and digital transformation of aged or healthcare systems is how we ensure that we actually affect that balance of tasks in a positive way and enable well-trained clinicians and workers to work to the extent possible to the full scope of their practice. I think the second observation, and there'll be folks on the call that have seen the digital health education and workforce roadmap that the agency published a little while back. And I think if there's one key takeout of that document, it's that both as a result of community expectations and growing maturity of our care systems, we're actually expecting new and different things of our healthcare workforce and also consumers. And so thinking about the different capabilities that we're expecting them to have and the points at which they're going to acquire those capabilities, either through employment or through formal education and training, is probably something that deserves additional focus in the years ahead.
Fantastic. And I think some of those comments on the workforce are really interesting. I think, there have been some concerns about, digital technology and AI, taking away jobs, but actually these are sectors that in general we don't have enough people and we're likely to have kind of staff shortages coming in coming years. So if we can look at ways where technology can really assist people in their day-to-day work and without kind of taking away that human touch to care that is also important, I think that can help us overcome some of those workforce challenges. They're really useful there. Staying a little bit on the theme of workforce, in terms of kind of the data analytics and the tech kind of workforce going into the innovation and the development of this technology, how are we sitting there in terms of capability within Australia? Have we got the right people getting trained up? Is the university sector, involved? Maybe Nick, if you've got some comments there about whether we do have the skills there, or if that's something we need some further investment in.
Sure do. So look, we know there's a big gap in the sort of digital health workforce in its broadest term, and there's I think there was a LinkedIn study some time ago looking at data scientists in the US, and there was a massive underrepresentation in health as an industry, and it's probably reflective here. And so I think it is hard in much of the public sector to sometimes attract the best and brightest, but the great thing about healthcare is that for a lot of people, it's incredibly interesting, it's incredibly satisfying. So we do get a little bit of pull and interest into it. So I think even though as we're evolving, technology is evolving pretty quickly, and I don't think the skills gap is because there's a whole bunch of people that have gone off to do other things. We've just haven't had the workforce catch up on what the technologies can do yet. So, for example, we've got a significant investment in our skills program. So it's a lot of what we do is go and run training seminars and education seminars, and that could be part of a project or whatever, and that has to continue as well. And the exciting thing, though, is that there are a lot of tools now that are becoming a lot more useful and usable for people to be able to leverage themselves. So, sort of citizen created applications with, low code tools that we have, so people in hospitals are actually spinning stuff up applications in a weekend, before they would have had to have gone to set up an RFT or some other process, and they can actually solve these problems for themselves. And coming back to the point I made before, I think that's incredibly exciting. We're empowering health services and this community to actually determine some of their own path. As they're not going to be able to necessarily go and build an EMR, but more complex systems. But there's a lot more tools that they have available to them. I think probably against that discussion, as we always have to think about, the regions and the remote communities, they don't necessarily have that same level of staffing, that, say, a metropolitan hospital system will have. So that's something that, we're very mindful as well, is how do we make sure that the skills training is spread across, regions and some of those areas that are in need as well.
Fantastic. Look, I'd like to touch a little bit more on telehealth, which I think everyone really mentioned a bit in their opening comments. And really, I think it's been one of the kind of big health winners out of COVID. And I think from a consumer's perspective, almost everyone sees it as a win. I think we've all benefited from not spending an hour waiting around in a doctor's waiting room. Mary, I'd like to throw to you here and just talk about how can we keep going with that momentum that we got through COVID and with telehealth, and how do you keep expanding that and making sure it is accessible to more people, and I think particularly in those kind of regional and rural areas, and are there any obstacles to that?
Yes. Look, I think what's happened as we come into 2021 is where everyone is both public and private sector, less talking about telehealth per se, because basic telehealth that operated last year is the doctor's got a phone, the patient's got a phone, and even if you FaceTimed it, you can even have video. So it wasn't that suddenly massive systems had to be put in. So it was possible overnight with a change to regulation as to the payment model that could reimburse healthcare providers if they delivered their care that way, which was the critical step that made that possible. And worldwide, in terms of take up of telehealth, it is the payment model that is the critical factor. But as we come out the other side of that, then there's the issue of, and I think at its peak, I can't remember, there were several million consultations going on in the middle of last year by virtual means, one way or another. But what we're really talking about with virtual care, when you get it to scale as a business as usual, you need to have a bit more shape about it. Whatever your practice management system is that if you're the clinician on your desk, how does it support it? Just because you're doing it on the phone doesn't mean you shouldn't be capturing patient information, for the record. You can't just have a chat and say, well, that was interesting, where's the patient record? One, it's required for quality standards and required to be maintained for, X years by law. Any health provider hospital or individual clinician has to maintain their records for statutory periods of time. Plus, it's also, fundamental to, safety and continuity of care. How do you conduct the consultation, given if you speak to people who do telehealth every day and have been champions of it, the way you set that up is different when is it a phone? Then what sort of conversation do you have first to establish the situation, because you've got no visual clues? If it's visual clues, how do you use that? And then when is it appropriate and when isn't it appropriate? And guidelines. So there's a lot to think through about then how you institutionalise it as business as usual. What's the regulatory and payment environment? And professionally and clinically, what are the quality standards that surround how you do it? And then how do you support and educate people about that? And of course, digital systems, adapting, GP doctor's desktop or what's happening in aged care and perhaps better connectivity to the GP on prescribing or whatever it is, can start to get people into, well, when you're doing this routinely, these are the things you have to do to make sure that it's going not just be safe, but that it's going to be fit for purpose, and that you're delivering it to the like patients, and not just in COVID. Of course, it had to be a workaround for everything, even when it wasn't that desirable. If you've got a very sick person at home, and ideally you would have liked them to be physically examined, but the risk of bringing them into hospital at when COVID was totally locking hospitals down to keep them safe, then you trade that off in that environment. So that's the work that needs to be done, and it's certainly, I'm sure, the sorts of things that the government's looking at in its review of what will be the arrangements going forward after the 31st of March. So it's a whole lot of stuff that isn't tech that we're talking about here that then has to be worked on. And it's iterative, because then the tech says, well, you can actually do it this way, in which case that means you think about, well, maybe the model of care that'd be good would be this, or the model of care that say, wouldn't it be great if we could do this? And then the technology comes in and says, yeah, we could do that. We could actually join that with that and use that My Health record saving, or let's standardise to the IHI and pull this bit of information in or something, and we could fix you and solve that problem for you. So it's this push-pull iterative process that goes on to get those things to work, rather than some genius in a garret thinking, I can think of a fabulous app to change healthcare. Usually those people are fit and well and dreaming up healthcare they'd like, and then coming and saying, the health, nobody's picking up my wonderful thing. Whereas it's much more powerful when it actually is being developed within and in partnership inside healthcare, and being tested as to, how does it affect clinical flows, regulatory flows, funding flows, and then you can move really fast if you bring all those things together.
Great, thank you. Look, unfortunately, we are out of time. I feel like we could keep going for a lot longer here. It's been a great conversation today, but I know I'm feeling really positive about the future of our healthcare system here. It looks like there's lots of great innovation on the horizon. I'm really pleased to hear that we are punching above our weight, and really are some global leaders there. So I think there's great things to come for us here in Australia. So I would like to thank our panel today. So we had Professor Mary Foley, Evan Rawstron, and Dr. Nick Woods. So thank you for sharing your insights and expertise. And I'd like to thank our live stream sponsor, Microsoft. Your ongoing support allows CEDA to lead a discussion on key policy issues. And finally, I would like to thank our audience for their time and participation in today's discussion, and thank you to everyone that submitted questions. Look out for the post-event email, which will include a link to today's recording. You can keep up to date with CEDA's program by visiting ceda.com.au. We have a lovely, shiny new website, and you can register for upcoming events on the website. And on the 26th of Feb, so tomorrow, we've got our Lord Mayor's panel on the future of Australian cities. And on the 12th of March, we've got a live stream on the Aged Care Royal Commission, so probably very interesting to many people listening today. So thank you all for joining me today, and look forward to seeing you at another CEDA event.